So as Dr. Smith is getting ready to present, just wanted to share very quickly a little bit about her background, although she needs no introduction because we've had her here many times before. Dr. Smith became a diplomat of the College of Theriogenology in 1986, and since that time, she has been in private practice as a small animal practitioner specializing in canine reproduction. Dr. Smith is one of few board-certified theriogenologists in private practice. Her expertise in genetic counseling, children frozen semen, and reproductive infertility of male and female canines is known throughout the United States. Dr. Smith frequently speaks to breed groups, veterinary associations, and students and the general public. Dr. Smith retired from full-time practice in March of 2023, but maintains licenses in Minnesota, Mississippi, and Colorado. Dr. Smith grew up in a military family that bred German Shepherd dogs. Her commitment to veterinary medicine began at 7 years of age and was confirmed in her high school yearbook, which stated her goal was the patter of 40 little feet, not human. So with that, Dr. Smith, I'm going to pass things over to you to get our presentation started.
Thank you, Nicole. All right, I think I can get this back up now. Let's see. All right, let me close that. And I think I can close. Wait a second, let's try this now. Okay, share. Okay, share. Okay, I think, can you see me now or not yet?
Yeah, it looks great.
Okay, awesome. Well, I'm delighted to be here again. And I feel so badly for Dr. Hesser as a breeder of Labradors. There's nothing more demoralizing. It's maybe even worse for veterinarians because you feel like you should be able to do something, and yet sometimes there is just not much that you can do. So today we're going to talk about patellar luxation, which is important in many breeds. And something sometimes not appreciated is it's not just a disease of toy breeds and medium-sized breeds. Several sporting breeds have trouble with patellar luxation, and sometimes some of the big mastiff types as well. So my name is Fran Smith. I am a diplomate in the American College of Theriogenology, and as Nicole said, I achieved that status in 1986. I'm a board-certified theriogenologist in small animal practice. I'm a breeder, owner, trainer, handler, and judge of retriever breeds. I'm the health chairperson of the Labrador Retriever Club, the president of the Labrador Retriever Club, and the president of the Orthopedic Foundation for Animals. So patellar luxation is a polygenetically inherited laxity of patellar ligaments causing luxation, lameness, and later on degenerative joint disease. So we're going to talk about a lot of anatomy here. So the bones and ligaments that make up the stifle or the knee area in the dog are the femur, which is the large upper leg bone of the rear leg, the tibia and the fibula, which are the two bones below the knee in the dog until you get to the hock, the patella, which is also known as the kneecap, the patellar ligaments, the lateral and medial collateral ligaments, and the cranial and caudal cruciate ligaments. So this next picture is a frontal view of the normal, of the normal knee. And if you look at where this arrow is in line with the fibers of the patellar ligament, you can see that the patella is located right in the middle of that patellar ligament. So when that dog's knee flexes and extends, that patella goes up and down and up and down. In the view on the right-hand side, the front view of a knee with a luxated patella, there's a couple of things that you may see. First of all, the patella is way off to the medial side. And for those of you who aren't sure, that's towards the middle of the dog. And that is the most common kind of patellar luxation In many dogs with luxating patellas, when the leg is bent or extended, the kneecap falls off where it should be and goes towards the middle. So I want you to keep that in mind. But I also want you to notice the difference. So here we have, excuse me, here we have the tibia, and this is what's called the tibial crest here. You can see, based on what this picture looks like, that all of these ligaments here with the long digital extensor are in a different place than in the normal view. There won't be a test on this. What you should know about patellar luxation, it's complex inheritance, also known as polygenetic inheritance, from at least 15 different chromosomal regions. What that tells you is we are never going to have a test where you can get a cheek swab or blood from a dog and find out whether they carry patellar luxation. That's not going to work with that many different chromosomal regions. There are two forms of patellar luxations: medial patellar luxation, which is most common in small and medium-sized dogs, and in that case, the patella does not stay in place and falls off towards the middle of the dog. Lateral patellar luxation, less common usually in larger dogs. One of the larger sporting breeds that has a lot of patellar luxation is the flat-coated retriever. It does occur in the Labrador retriever as well. But in toy breeds, the incidence in many breeds is very, very high. In Pomeranians, which are one of the most commonly afflicted breeds, the incidence of patellar luxation may be as high as 75%. So what causes it? Remember the picture I showed you under the 6th slide? The pathology begins way up at the hip joint. And in normal dogs, the origin of the rectus femoralis is right near the midline. Excuse me just a second. And in the quadriceps is located between the axis of the muscle and the patellar tendon. Increases in the angle between this quadriceps and between the bone structure itself, between the axis of the muscle and the patellar tendon, causes a change in an angle, and that causes medially directed vector forces pulling the patella medially. Explaining that in non-scientific methods, it means when the dog flexes or extends at knee, but particularly when they flex their knee, which is to bend it, the pull of the muscle due to the forces of the muscle literally pull that patella out of position and bring it towards the inside portion of the dog. And the reason I make such a big deal of this, oftentimes owners of dogs with patellar luxation think that there's something wrong with the kneecap. The kneecap is fine. It's the way the muscles and the angles of the bones are that causes this to happen. So it's not the kneecap, it's the rest of the anatomy. The earlier this luxation occurs in the dog, the more significant is the effect on function on the joint and the degree of our arthritis. So young puppies, if you have a 7 or 8 week old puppy, you flex and extend the knee and you feel that kneecap pop off, that dog is likely going to need significant surgery early on if it's going to have a functional life. On the other hand, say you've done your patellar checks and a dog can have an OFA patellar clearance anytime up to a year as a prelim, and after 12 months of age as a clearance, and they actually get a patella number. So you have we're going to say you have a cute little bitch, and she was normal at 12 months, okay? At 18 months, now her left patella luxates, so when you bend her knee, her patella falls off to the inside. That dog may stay sound for its entire life and may not need intervention. So why should you care about that? Well, there's a lot of reasons. First of all, none of us want dogs to be sore or painful or develop arthritis. But as someone who is hoping to rehome their puppies, or home their puppies rather than rehome, place their puppies responsibly, when a veterinarian who is the new veterinarian for the puppy that's just been placed, when they palpate that dog's knees, if there is a luxating patella, many of them, including if it were me, would say, did the breeder tell you this dog has a problem with its patella? And usually in that case, the owner says no. I said, well, you should call them and see what they say. And if you decide you want to keep that puppy, fine. But you need to know that potentially you could be, you are likely to have expensive orthopedic surgery later in life on this dog. Now, will all of them have that? Not at all, but it certainly can happen. This diagram here explains what's happening when you extend the leg versus flex the leg. So when you flex the leg, you're taking that leg and pushing the leg upward, causing the knee to bend at this big joint right here. When you extend it, you're bringing the leg down, and that makes the whole rear end stand at a normal standing position. But all of these joints rely on flexion, extension, rotation, laterality, et cetera, et cetera. The OFA patella database is open to a dog of any breed or combination thereof at least 12 months of age. And so you can certainly have patellas examined on your puppies, or if you buy a dog, certainly under 12 months of age. The examination may be performed by any licensed veterinarian, and it's performed on the standing dog, typically without sedation. If the patella can be luxated while the dog is standing, the guidelines for grading the patellas say that it must be graded at least grade 3, which is really bad. So let me give you an example of that. I take a dog back to my x-ray area for some other reason. Maybe it's even a pregnancy x-ray. And we stand the dog on our x-ray table, and I stand behind it, and I happen to put my hand over the knee. And when I move the leg, the patella falls off. That dog has really, really, really bad patellas, even though I was not asked to do a patellar grade. You cannot miss it if you are doing that kind of exam. For those of you that watch dog shows, and we'll talk about this a little bit later, or if you go to dog shows, I think you will see, if you watch dogs gait, many of the toy breeds, some of the smaller terriers, that the dog will go along at a nice trot, and then all of a sudden it will skip and then stick its leg out behind. What that dog is doing is trying to push the patella, which is luxated, back into position. So there are 4 grades of patellar luxation. The grading system applies to whether you have medial, which means it goes to the middle, or lateral, meaning it goes to the outside patellar luxation. In grade 1, when I bend the knee, the patella easily luxates towards the middle at full extension of the stifle. So I push it up, bring the leg down, and the patella pops off. But as soon as I let the leg go and let the dog move its leg, the patella will go back to where it's supposed to be. Dogs with grade 1 patellar luxation typically are not lame. They could be, but they're not. In grade 2, there's frequent patellar luxation, which in some cases becomes more or less permanent. Remember, we talked about if the patellar luxation starts younger, you're going to have more and more arthritis as the dog gets lame. So ultimately, a grade 2 dog could end up continually lame. The dog may or may not be able to, to, I'll get there. The dog may extend his leg to get the patella back into the correct position. That skipping that I talked to you about. The dog may be lame, but may not be. In grade 3, the patella is permanently luxated with torsion of the tibia. So that means I showed you on that first exam the tibia, and it looks like the whole tibia is twisted towards medial, and deviation of the tibial crest between 30 degrees and 50 degrees from the cranial caudal plane. Flexion and extension of the joint causes abduction and adduction of the hock. So I'm going to run back up here because I think now I'm good enough at this that I can find the picture again. I can, look at that. All right. So in a dog with grade 3 patellar luxation, so the kneecap's mostly towards the inside, when it tries to walk, it tries to compensate for what's going on in the knee with movement of this hock joint, either abduction, meaning away from normal, or adduction towards the center. So it's an attempt by the dog to enable it to walk more efficiently. All right, grade 4. In grade 4, the tibia is medially twisted even further, and the tibial crest is even further towards the middle, with a result that it lies 50 to 90 degrees from the cranial caudal plane. In this situation, the patella is permanently luxated. The leg is either carried, meaning the dog can't walk, or if it's bilateral, you'll occasionally see, and I've mostly seen this in Pomeranians. I have to tell you, it's a breed I really, really love, but they stay crouched in their rear end with their poor little knees kind of bent towards the middle. So what are the risks by breed? In order to understand risk, one needs to understand, both the risk of the disease and the odds ratio and the incidence of the disease. So the first thing we're going to talk about is odds ratio, which is a really interesting comment. I get very annoyed with researchers who call me and say, we would like the Labrador Club, which I told you I'm the president of, to support research on X, because as you know, Labradors get a lot of X. So then I typically will say to that researcher, and what kind of statistics did you use to determine that Labradors have a lot on this? Did you correlate that to the fact that for 20 plus years, Labradors were the most popular breed in the country? So if you were likely to see what breed in a tertiary hospital, a specialty clinic that is, or a vet school, you're going to see the most of, pretty much Labrador retrievers are going to have the most of everything because they have the most sheer numbers. That is not an odds ratio. An odds ratio is a statistic that quantifies the strength of the association between the breed of the dog and patellar luxation. And I'm going to give you an example of that. An odds ratio of 1 means that your dog or any breed of dog is no more likely to have this disease syndrome than any other dog or breed of dog. So odds ratios, the higher they get, but any time that they are higher than about 1.5, they're significant. And I'll show you some details on all of this. The next thing we talk about is incidence. And incidence is the association, is the occurrence rate or frequency of the disease. And that is important because particularly with today's new genetic test panels, you can get all kinds of tests that, while they are accurate, will not give you any sense of how frequently that occurs in dogs, hence the incidence. So an example again, and I'll use the Labrador, if you were to look at the incidence of copper toxicosis in Labrador retrievers, it's very low based on the population. However, based on the genetic test, a lot of dogs will test positive either as a carrier state, and some of them have traits that allow them to be spared the trait. So the incidence, even though the disease occurs, a very small percentage of dogs that have, of Labradors, will ever have clinical disease due to copper toxicosis. So this is an example, and I think that this is a really important slide for you to see. And this is the most current data in our OFA database for breeds of dogs that have normal patellas versus not. And here it shows the number that have been submitted. So these are dogs of age, so more than 12 months. And what would this tell you? For one thing, I can tell you that OFA databases are heavily biased towards normal. And why is that? Does that mean they're not accurate? No, they're accurate for the information that we get. But because most people elect not to send in abnormal data, it's biased towards being normal. A classic example of that would be the OFA cardiac database, where for every breed that is in the database, normal versus abnormal is in the 97 to 99 range versus 1% abnormal. Does that mean the Cavalier rarely has heart problems? No, it means the people whose dogs don't pass the heart testing tend not to send that in. And that's important at an area that we will get to a little later. So I want to point out a number that we don't often see. OFA does maintain a database for what are called hybrids, which are a combination of any two breeds and does include all of the doodles, most of what I call the little fluffies that are combined, et cetera, et cetera. So in the OFA database, they are listed as a hybrid. It doesn't even identify what combination. And here you will see that we have 11,403 hybrids in the database, with 99% of them being normal. We did have a few people that did send in the abnormal. Obviously, the Yorkie people have a lower percentage of normal and a 16% degree of abnormal, which is probably much closer, but still underestimates the percentage of luxating patellas in the Yorkshire Terrier. So again, this is important because you can see how databases get biased by failure to submit results. And I always like to say to everybody, remember, having a genetic abnormality as a dog is not a criminal act. It's a fact, and that fact can be used constructively to help you do a better job. So now we're going to go through some breeds that I think you'll see as common and breeds that have a lot of patellar issues and talk about what their records are. The first one is the Dachshund. The Dachshund, when I say older OFA data, indicates 7.1% was affected with patellar luxation. Our newest data shows that we have 4,027 dogs in the database with 96% normal. Does that mean, does that mean that the incidence of patellar luxation has gone down from 7.1 to 4%? No, it actually doesn't. And I'm going to show you an X-ray of a dachshund. All right, this is actually an X-ray of a dachshund, and it was taken for the purpose of doing OFA hips. I'm going to outline here. Here's the patella on this right side, and here's the patella on this left side. So we can use that as an example of, and you don't need radiographs to do a patellar exam. It's an exam on a standing, unsedated dog. And what we look at OFA is the percentage of the hip that's in the socket, how deep the socket is, any bony changes. This dachshund happened to get an OFA excellent. Okay. Chihuahua, again, our old OFA database said we had 5.5% incidence. Currently, we have 94% normal. But when we look at the odds ratio, what are the odds that a Chihuahua will have luxating patellas versus a random bred small breed dog? 7.91 times. So what does that mean? You as a purchaser or owner of a Chihuahua, that should be a high priority for you in selection, that you have a dog with normal patellas. And here is a Chihuahua. Again, you can see these cute little patellas right here. This is the tibia, this is the fibula, obviously this is the pelvis. And this was a Chihuahua with an OFA excellent. All right, let me see, where am I now? Next one is a Maltese. Old OFA data says 5%, current data 96% normal, so only 4% normal. However, there are several different sites that list odd ratios for a Maltese to have luxating patellas, and one is 1.92 times, so about twice as frequent as in a random dog, and in another site it's 6.5 times the likelihood that a Maltese will have abnormal patellas. And here is a Maltese with a beautiful pelvis. I'm showing you all OFA excellent patellas. The other thing I want you to know, this is OFA data. I was not given and did not ask for. I don't know who the dog is. I don't know who owned the dog. I only know the breed and the sex of the dog. And I can tell that this is a female because there are no testicles in this picture. How about Cavaliers? 2.3% incidence of patellar luxation. Now we say 98% normal, so around 2%. So that really has not changed much at all. Remember, we are biased towards normal because many people do not send in the abnormal data. And this is the Cavalier. Patella here, patella here. I would predict, although I do not know, and remember, I don't know who these dogs are and I don't want to, that if you did a patellar exam on this dog and you were good at it, and the dog was very relaxed, that this patella could luxate medially. You think back to the other pictures, the patellas were much more in the center. All right, here is another patella, and this is a beautiful pelvis. Again, kneecaps here a little more towards medial than I would prefer. And yet another, and all three of these Cavaliers received an OFA excellent based on the OFA scoring system. The Yorkshire Terrier, this breed has lots of patella issues. Older data is 23.8% of dogs having patellar luxation. Currently, we have 84% normal, so that's 16%. Again, look at our odds ratio. They are listed as 7.86 times and 8.3%. Interestingly, the Yorkshire Terrier Club did a health survey in 2006. Now, when clubs do health surveys, no one verifies what people report. But back in 2006, Yorkie breeders or owners only reported that 2.6% of their breed had luxating patellas. I doubt that that was accurate based on this data that we have currently. So this is a Yorkie, and this patella, again, this was a dog that had beautiful hips for OFA, so it's not being evaluated for anything else. This patella right here is darn near off. Again, I suspect that that dog has marginal patellas. Here's another one. This one has two that were very much towards the middle, but an OFA excellent pelvis. Here's where the patella should be, right in the center of this trochlear groove on the femur. And then I want to show you this, not because it's patellas or hip dysplasia, but because it's another common disease that affects many toy breeds. If you look at this hip, the head of the femur is basically collapsed, and there really is no existing still head. This one is not quite as advanced. This is a disease called leg calf Perthes disease, which you take the same x-ray as you would for an OFA film for hips, but you're looking at a different malady. And I will tell you that dogs with leg calf Perthes are profoundly lame and typically need surgery to make them comfortable. And additionally, in my opinion, a dog with leg calf Perthes should never be used in a breeding program. And that I would include that even if they have their leg calf Perthes, quote, repaired, because the genetics will still be there. The next breed is Havanese. Havanese, really, the club has done a fabulous job. They have a low level of luxating patellas, and this breed does almost the most health testing that there possibly is for any toy breed. The club is very, very, very committed to health. So this is a beautiful pelvis. Patellas right in the center over the trochlear groove. Hips in the socket. Backside of the pelvis covers most of it. The foramen are exactly the same size. That's an OFA excellent. But here again, they do get some leg calf Perthes. The right hip here is normal. Look at this. This whole left hip has collapsed. We do know that leg calf Perthes is a genetic disease. So again, you don't want to use those dogs in breeding. Poodles. Toy poodles have 97% normal listed in our database. Odds ratio for a luxating patella if you're a toy poodle is 9.7. For mini poodles is 4.1. And standard poodles is 3.2. Over my life, I have owned several standard poodles, all of whom had normal patellas. And I have owned 2 toy poodles, neither of whom had normal patellas. But since my significant other is an orthopedic surgeon, that is easy for me to deal with, and I wasn't intending to breed them in any way. Hybrids. So hybrids, again, include any combination, golden doodles, labradoodles, bernedoodles, etc. We do have a separate designation at OFA for the Australian Labradoodle, which is a distinct breed. In our database of hybrids, the incidence of patellar luxation is 1%. Now, remember, these are dogs 12 months of age or older and do not correlate with hip findings. So the next thing I'm going to show you, because you want to know now, how do you fix this? What can you do to decrease your incidence? And I'm going to use Labradors because these are my dogs and I can share any data that I want. So this dog is a dog that I bred, owned, trained, and handled, champion Danica Leap of Faith. There's a master hunter, which is the highest hunting title that you can get. And I'm going to show you his OFA record and his vertical pedigree. Because in addition to actually doing the diagnostic tests for patellar luxation, vertical pedigrees will give you lots of information on which dog to choose as a stud dog if you're trying to decrease your percentage of unfortunate results. Will it tell you everything? No, because we only get the data for vertical pedigrees from people who have sent it in. So this dog had, as you can see, was born a long time ago. He was born in 93. He is OFA good. His elbows are normal. He had advanced cardiac testing. He had patellar testing. And he had multiple eye exams. And he is listed as a CHIC dog. And CHIC is the Canine Health Information Center. The Labrador Club and most breed clubs have identified what screening tests a breed should have in order to be given this CHIC award. Now, CHIC award does not mean necessarily they're normal. If an owner had a dog, say for instance, we call this dog Bungie, if his hips had not passed and I had been willing to put them in the database, which I would have been, he would still have been able to get a CHIC. So it's not about normalcy, it's about sharing information. So here is, if you go to his page on the OFA, what I wanted you to see across the top of the dog's information or somewhere, this is not the newest screen, you can click on what is called vertical pedigree. And what the vertical pedigree gives you is information on the parents, the siblings, the grandparents, the half siblings, etc., as to what their health status is. So we're going to go right here and you'll be able to see this. Okay. So this is the hip status vertical pedigree. So Bungie was an OFA good. He had one sibling, which was OFA good. He produced 23 offspring, 8 excellents, 14 good, and 1 preliminary good. Then you can look at his grandparents and his great-grandparents. Now, what would give me any pause here? Well, the biggest thing that I would be aware of, I can tell you that his grandmother, paternal grandmother, did not ever have her hips x-rayed. I can tell you she was born in the United Kingdom and they do things a little differently than we do. All right, so let's go on to the next one. Here's the elbow status. So Bungie again had 21 offsprings, 19 that were normal, 1 that was preliminary normal, so it was over 12 months but under 24, and 1 with grade 1 elbow dysplasia and 1 elbow. What do we know here? Where do I think that elbow issue came from? Well, the reality is, if you look at this, none of the grandparents have any elbow data. So in using him for breeding, I certainly would pick dogs that were grandparents that also had normal screening and had normal siblings, etc., etc. Now, this next dog is Bungie's son. You can see right here that he cleared everything. In fact, he got an OFA excellent on hips, patellas, and cardiac. He was good there. Hip vertical pedigree. You can see we're really strong on hips in this particular pedigree. Very, very good. So excellent, excellent, goods, goods. Everybody, we have lots of information. Elbows, again, we lost out a little bit once we get over here. These were 2 dogs that were a long time ago. So what am I going to be careful of? Again, when I use this dog for breeding. I want to have as much depth of pedigree for normal elbows as I can possibly find. The same would be true if this were a patellar exam. So what's CHIP? We talked about this. It's a centralized canine health database sponsored by OFA. CHIP works with participating parent clubs, is a resource for breeders and owners to research and maintain information on the health issues prevalent in specific breeds by establishing a recommended protocol for breed-specific health screening and recognizing dogs tested in accordance with that protocol. I think that might be the end of my slides. So I think, Nicole and Nate, that we have time for some questions. Do we have any pre-submitted?
We do. Thank you so much. That was fantastic. We do have multiple questions here.
Good.
One of them you referenced earlier relating to the preliminary testing and the final testing. Someone wrote in saying, I have always OFA'd my dogs at 1 year of age and then again at 2 years of age. What are the odds that the patellas luxate after 2 years of age? I know you referenced that it can happen, but wondering if you have any percentages or what have you. And then also, is there any truth to patellas being an issue of luxating at a younger age due to an environmental reason?
Okay, so I'll do it both ways. I'll do the environmental one first. Since patellas are primarily genetic and anatomy, environment is not going to do it. I get asked all the time, I'm sure it happened when she jumped off the couch or fell off the bed. Doesn't happen. So that is not the issue. It would be very rare for a dog over age 2 to develop a luxating patella unless there is a situation where a severe trauma might do it. Say, for instance, they tried to climb out of an X-pen, ended up hanging by a hind leg for a while, thrashed around. That might, but not with normal activity.
Great, thank you. And that kind of answers the next question we had. If a dog has a unilateral luxation, how likely is it to be genetic in origin versus possibly traumatic?
They're genetic. We can all wish they were traumatic, but it takes huge trauma, even to a small dog, to cause a traumatic luxation. Ask any of us who do surgery and try to reduce any kind of luxation. It's not going to happen with day in, day out activity.
Great, thank you. Another question was, at what grade of luxation do you recommend surgery, or is it specific to that individual patient?
Okay, so you don't want to ever do surgery on a dog that doesn't need it. So my rule of thumb is if the dog spends at least 50% of its time hopping or not using its leg normally, it should definitely have surgery. Less than that, there are plenty of little dogs that I saw for all of their lives who would maybe have their patella luxate briefly once a year and it would pop back in on its own. Those dogs don't need surgery.
Great, thank you. Yes, more of a quality of life question. Someone else reached out. Does luxation reflect muscle condition as much or more than anatomical conformation and or genetics? Can luxation improve with muscle conditioning?
The simple answer to that is no, just like it's not environmental. If you kept a dog in a little tiny box for all of its life and it had normal anatomy, well, that would be cruel, and I don't want you to do that. It still wouldn't cause the dog to have luxating patellas if it did not have the genetic predisposition.
Great, thank you. And we have one left, more of a general question, but do you have any recommendations for best diets relating to orthopedic health?
I am a huge fan of all life stage diets for dogs at every stage of their life. And so Purina makes a number of all life stage diets, but even if you don't want to feed Purina, read the label and you want an AFCO feeding statement on the back of the bag that says this food meets the standards for all life stages based on feeding trials. Those are the premium, the platinum foods. What you don't want to do is feed your breeding dogs differently most of the time, and then when you're going to breed them, switch them to something better. They need to have good nutrition all the time. Plain ketchup is really not effective.
Amazing. Thank you. Nicole, I'll turn it over to you.
Awesome. Thank you both. This was such a great presentation, such a great Q&A, as always. Thank you to our audience for joining us today, for asking such great questions, and just being such great participants in general. If you are not yet a member of our Good Dog community and you want to join us, you can apply to join anytime at gooddog.com/join. Also, if you have any questions about our community and what it's like and what it means to join before you submit your application, you can always reach out to us at breederteam@gooddog.com, and someone will happily answer those questions for you. And before I let everyone go, I want to give a sneak peek of our next webinar, because it's always nice to have something on the calendar to look forward to. It's going to be on Wednesday, April 23rd at 1 p.m. Eastern on Facebook Live, just like this. And it's If a Little is Good, More Must Be Better. A little bit of a vague title for this one, but Dr. Julie Cesari is going to be joining us again to talk about common prescription drugs and whether they're suitable for breeding dogs and neonates. So not something we've really covered yet this year. Really excited about that. But until then, thank you all for being here. Dr. Smith, as always, thank you so much for leading such a great conversation for our community. We hope to have you back here soon. And to everyone else, we will see you at our next webinar on the 23rd.
Thank you all. And Dr. Cesare is great. So
yes, the
yes,
best.
Absolutely.
We're excited to have her.
Yeah. Thank you all. Good night.
Thanks. Bye.